Each totally went
the next year.
All right, so we are live. This is Senate Health and Welfare. We're back and we're trying to get some closure on H91. Katie, we have some new language that we have talked with the agency about to get to a better spot. And so can you show us what we have?
Yes. My color coding is now off, but that's okay. You don't have fun. I'll talk you through it anyway. So this is a draft 7.1 that has not been edited yet. We have the same section 8 that we were looking at before with a new clause on the last sentence. So to remind you what section 8 was, this was the report that is coming back on November 1 from the department that would propose a detailed plan for accelerated implementation of VHARD. Same first sentence. On or before November 1st, 2025, the department shall submit for consideration a detailed written plan, including a timeline to accelerate implementation of VHARD as part of the fiscal year 26 budget adjustment process to joint fiscal, the House Committee on Appropriations and on Human Services, and to the Senate Committees on Appropriation and on Health and Welfare. The plan shall address the readiness of community providers to implement the program prior to July 1, 2026. Fiscal estimates for the remainder of fiscal year 2026. This is the new language. And an assessment as to whether the program is anticipated to be operable by July 1, 2026. Okay, that's part 1. Part 2 is a change in the appropriations section. So let me scroll down. First, this number looks different because the 500,000 that had been specifically appropriated for DCF is now rolled into this number. It had been 500 plus than that. I forget what the exact
4.585.
Thank you.
500.
Yeah.
Okay, so that money, that 500,000 has been rolled in here. And instead of distributed to the community action agencies, this money would go to DCF to plan for the implementation of VHARD as needed, which may be distributed to entities such as the community action agencies.
And we actually had talked about this earlier, about how the money is used. And I know there's a budget that the CAPS put together, but it's difficult. How else do the money's going to go through DCF and it needs to go when folks are ready to use it. So that's all this does. And it gives reassurance to the administration on the appropriations process.
Those are the only, that's it?
Huh?
Those are the only things.
That's it.
Can I ask a question about the first provision that you brought up, about the plan? If the plan comes back and says, actually, no one is ready to do this work before July 1st, then what happens? What is in the bill for?
There's another report that's coming in on January 15th, but from the CAPS that would give an indication that, gee, that this is what they said in November, but we get it. We're ready. All of those barriers that were identified or the problems, or they'll say, yeah, no, you're right. We can't do it. So there's an opportunity for change. Also, with this report coming back, it gives us, the legislature, notice about what we need to do in terms of legislation to improve whatever has to improve to be hard.
All right. It's not a perfect bill.
No, it's never a perfect.
So rather than give the money directly to the CAPS, we're giving it to DCF and they will distribute it to the CAPS as they deem necessary.
Well, or as it becomes part of the program. So for example, I see some money being used over the summer and fall to convene meetings and to get CAPS working together and building capacity. Then after that, there's a lot of money in there for hiring folks.
Yes.
And they don't really need to hire folks right away, but they certainly need to plan for that. So they'll all have to be collaborative. Yeah.
Just a correction, the money was always going to DCF because we never appropriated directly to the CAP.
right,
It just changes how,
it just
it just changes the direction of
the
DCF.
direction of it. Doesn't change it. Doesn't change it there. It's in the budget, it's in the bill. If we don't identify it for use, it becomes loose money and loose change that anyone can pick up. But we don't want that. Amy,
Amy Schollenberger for VCAP. May I just ask a clarifying question?
sure.
Um, it's two parts. So, the first part is the staff people that are contemplating being hired by the CAPS are people to do the plan. And so I would, this question's almost for Commissioner Winters, but if DCF is not planning to appropriate money to the CAPS to do the plan, then we are not going to be able to, then the CAPS will not be able to accomplish the things that are mandated in the bill. So that's the first question, is the intention to delay the appropriation. And the second question is the way that's worded, it sounds like it's going to be an RFP open bid process and not actually being directed to the community action agencies. And to me, that seems like you need to change the policy language in the bill if that is what the intention is.
No, the intention is to do exactly what's in the bill. And then as money is needed by the CAPS to complete the work, to have have DCF send that money out for you. So it's not a different process from other appropriations that are made in the budget.
And I'll just confirm that, Senator, and also say, I think it's like another gate along the road to get there in phasing the funding when it's needed. Makes the administration a little bit more comfortable that all, I think it's about like 6 positions per community action agency aren't needed on this July 1st. That we have some steps along the way to ensure that the preparedness is there. And that the plan is good to go forward before sending more money out the door.
Okay, no, this is it. And I want the committee to weigh in on this one, and we're gonna vote on the bill with this language pending a clean copy. Because we are at the end of our time, and we do have one more thing that we want to do, so. Katie, tell me how we should address this.
I just got edits back from, so I think we could vote on 7.1. The only change was, changing by July 1, 26 to honor before July 1, 26 from the editors. So otherwise, I think the language I have is okay.
Yeah, so the 400,000 for the central bounds, folks,
We're keeping them separate
you want to,
deliberately, yeah.
you already know my question.
Yeah, it was a good question, because I asked the same question. We tried to sort that out together, and we did that. So we're trying to keep that separate. All right, okay, so what would the vote be, Katie, if we're a motion?
On draft 7.1.
So, we have a piece of paper.
Yeah, I have one.
We have to vote to amend the bill.
To amend the bill, the draft 7.4.
Yeah.
I will make that motion. Thank you.
Everyone straw voting on that one? Got 7.1.
Amend.
To amend. Yeah. Okay, good.
I'm sure we're lucky.
And if we don't do this, that's it. Okay, and it's all work that we've done is gone. So I'm just saying, it's not easy, and we've reached some agreement with the administration to keep it moving forward. Okay, is there a motion on draft 7.1 to report to the full Senate?
I'll make a motion on draft 7.1 to move it out of our committee favorably for the full Senate.
Okay. Discussion? It's not a perfect bill. We got it late. We worked hard. We tried to resolve issues with a lot of different interests. And we've gotten to a place where everybody's unhappy, and that's usually a good place. Senator Douglas.
You said I'm happy. I've been loving this bill this entire time we've been working on it. It's one of the things I'm most proud of this entire session. And I find myself in a position where I think I'm not going to on it.
Because,
A lot of it's the eligibility. I would rather see us have that more concrete and not just waiting for a plan back in DC.
okay, can I just share with you that we cannot put that eligibility in there because that would be amending the budget. The budget is not a bill yet. So we can't amend a bill that is not a law. We can't amend that. So we can't put that in. That's something that the administration would like. If that's something for consideration, we can bring it up in conference committee. It can come up another time, but you can't amend something that is not amendable. That is a problem. And I understand what you're saying.
Yeah, it's, as I said before, it's not a perfect bill. I am going to support it because there's some great provisions in here that will save people's lives. And I want to keep it moving. People have worked really hard, and thank you to everyone in the room you've all worked super hard, and Katie, you too. So I'm gonna vote yes.
Yeah, actually, thank you, Katie. Sorry, I wasn't the thought, but thank you, Katie.
Okay, so I think we're ready to vote. I mean, if there's something missing in the bill that you want, we can't put it in there. But if it's in the budget, okay, just so you know that, that's a big deal. All right. So Senator Douglas, will you please call the roll?
What?
After you swallow.
First of all. All right, and I already have it all written down too. What's your number, Katie?
7.1.
Thank you. All right, Senator Gillis,
Yes.
Senator Lyons.
No, I'm last.
Oh, you're last. Okay. Senator Hart.
Yes.
Me. Senator Cummings.
No.
And Senator Lyons.
Yes. Interesting 3-2 vote. Cool. All right. Thank you for that. We've passed the bill out. It now will go to appropriations, then it will go to conference. And I think Senator Julik and I will be reporting the bill and
All right, 2 minutes.
huh?
All right, 2 minutes. Oh, okay, cool.
What? Can you write my name down?
Well, no, you said you were gonna do it together.
Yeah,
right?
Lions and Julik.
Okay.
Put Lions down and then I'll see.
Okay, I'll put Lions then.
Yes. Same. All right.
Really
It's an imperfect bill in everyone's eyes. But if you voted no, you're not on the conference committee. I'd be lucky.
You know, it was very disrespectful of the committee and especially the staff.
Yeah.
And Katie's done 7 drafts this bill.
Yes.
And wait until the very last day when the bell is literally ringing is disrespectful.
Got it.
Sorry.
I think we got 1 minute to get upstairs.
The message.
We're gonna.
Thank you.
Thank you.
Thank you.
We also have our committee, Janice here. We have a resolution that we would like to consider as a committee. We're not done yet.
We're not done.
No,
We're supposed to be there.
We can.
Larry,
we can be
we're
late.
gonna be late. We're gonna be late.
They're gonna be late.
They're gonna be, okay. Well, they're gonna be all right.
thank you, Nolan.
Yep.
No one said thank you to you, but
Oh, thanks, Nolan.
we would have this bill, the administration will help move it along. Anyway,
While we're waiting for Jen, we need to be, can we move S 154, the fire for Alzheimer's bill out of finance into public welfare? If that's okay with both of you.
go ahead.
Well, someone will have to say something on the floor.
That's the chair of the finance committee,
Okay.
if she wants to do it. Yeah,
Unless you want to.
No, we can do it on Tuesday
yeah.
and,
Okay.
schedule for after this.
Yeah,
I know, we'll just
We'll cancel.
cancel it. I wouldn't mind sending people home a little early too.
Yeah, and they're fine with this not coming up until January, so it's, okay.
Run it by Randy.
Okay.
Since he's the co-sponsor.
And do I need to talk to Boomer too?
Yeah, you need to tell them we're gonna meet up.
Got it.
Okay, what's the resolution?
It's just about what's happening in the healthcare world at the federal level.
You see, United Healthcare is in big financial trouble.
Was this referred to committee from the floor?
That's what we're doing. It's a draft.
Oh, is this committee resolution?
Well, if
Currently
it to be.
unattributed.
Okay,
Right. You ready?
so do you want to show us the resolution?
Yes. Morning, Jen Carvey, Office of Legislative Counsel. Here is a draft resolution. Senate resolution opposing recent federal actions that threaten public health and urging their swift reversal. It goes through a number of actions. So the motion on January or executive order on January 20th to withdraw the United States from the World Health Organization. I don't know if you want me to just hit with where it
Yes,
are.
yeah, hit the big highlight.
So it talks about concerns related to that. The elimination of approximately 20,000 jobs from the U.S. Department of Health and Human Services, including at the Centers for Disease Control and Prevention. A number of areas were cut there. Elimination of the entire Management Regulations Division at the Center for Tobacco Products in the Food and Drug Administration, and most of the staff at the Office on Smoking and Health at the CDC. The National Institutes of Health refusing to award grants to universities that operate any programs that advance or promote diversity, equity, and inclusion. The cut of approximately $1 billion in federal grants that support mental health services in schools. And then it ends with a clause on the leadership of the U.S. Department of Health and Human Services lacks understanding of science and scientific research, including a peer-reviewed research regarding vaccines and autism. Then resolves that the Senate stands in support of science, opposes these federal actions, and urges their swift reversal. And would have the Secretary send a copy to the President, the Secretary of Health and Human Services, and the Vermont Congressional Delegation.
You know that's gonna get sent here as a bill.
Well, if it comes out of the committee,
There's nothing in there that talks about an impact on Vermont. And therefore, I think it will be divisive at a time. Probably don't need things to be divisive.
well, it will impact Vermont. How can we say that?
I mean,
Because it will limit research capacity. It will limit our
I mean, I didn't read a lot of the stuff that
Funding.
describes.
funding for our tobacco control programs.
I just
Our
think
recognition
it
of
will,
diseases.
given the speeches, and this sounds like one of the speeches that have been being given, I think it could just be seen as divisive.
I think it's a shame that this is divisive. I mean, standing up.
Yeah.
I'm not interested in standing up and making a speech, but I do think that we've seen some really awful things happen to our healthcare world. This isn't healthcare, it's more. Oh, your maternal mortality and maternal child health. I mean, what could be more compelling than that? Yeah, why don't we add into this in Vermont and the United States?
Also, does it have to, so we're asking if this be a committee resolution, is there an option if it isn't a committee resolution? Or does it have to be?
No, it doesn't have to be. We can sign
Yeah, and
whoever wants to sign
anybody
on
who
to
wanted to just be a regular resolution, and
Yeah.
that would be referred to the committee.
Yeah,
Referred back to
to a committee that's no
which
longer-
is the normal process.
Yeah.
So everyone gets to be heard on it and have something to say about the
Right.
word.
Maybe we should just do that because just because of time.
So is there anyone on first read, if you'd like to sign on to it? Could do that. I'm happy signing on to it.
Yeah, have you sign on to it?
If we could do it more specific in Vermont, that's.
So we can add some Vermont language, some Vermont where it says, the United States and Vermont.
Yeah, the citizens of Vermont are being.
Can you sign on to it?
Not off the first reading, yeah, for second, especially that appended copy.
Yeah,
Is that posted on the, Kiki, is it posted?
so why don't we do this with it? We'll put it up on the screen. Jan will put, not right now, no. I mean, we'll put it on our webpage. Long words. We will then look at a new copy with the word Vermont and implications for the state. Then we'll huddle in a corner one day next week, early, like Tuesday, and decide who might like to support it. Support it as a committee, fine. And if not, then those who would like to can do it.
And Vermont is in real danger of having a measles outbreak.
Yeah.
That is huge.
All I need is one kid to go to Disney World and bring, we
I know.
already have.
Yeah.
I know, and if you have a
It's
pregnant
deadly.
woman contract measles, she's gonna have a child with
German
hearing
measles.
loss, with cleft palate, with
Yeah.
those things that,
German
yeah,
We used to call it roseola, apparently I have.